Hi, my name is Laurel and I'm going to be doing the enteral meds today. So the first thing I need to have my medications. I need to have 2 med cups, a syringe, a measuring tape, a towel which is already in my patient's room, gloves are which are in my patient's room, and I need sterile water because if you use tap water you can introduce bacteria. So I'm going to crush up my medications using the med crusher. Then I'm going to put them into my med cups. If I have more than one, I'll do the same thing. The next thing I'm going to do is put sterile water, 30 mLs into my cups. And then I'm going to gather my medications and go to my patient's room. Oh, sorry. Okay. So the first thing I'm going to do is I'm going to check my patient's armband, and I'm going to make sure that it matches my doctor's orders for medications. Can you please tell me your name and date of birth, please?
Brandon Beck, May 4th, 1995.
Okay, so you're good to go for medications today. So I'm going to go ahead and put on gloves now. I already have my patient draped for medications to protect their gown and all my bedding. So I already have my patient draped, making sure that it's underneath my medication tube that I'm going to be administering into. I'm going to take my measuring tape, starting at the nares, measuring the length of the tube outside of the patient to where the tube is. Mine measures 8 inches, so that is what matches my doctor's orders. So now I'm going to pull 30 mLs of air into my syringe. I'm going to change this to be off after I connect it. Once I've connected it, I'm going to change it off to the block, push the 30 mLs of air, and pull back the stomach contents. This patient has given 40 mLs of stomach contents. I'm going to check the pH of that. Then I'm going to put it back into the patient. Then I will turn it off to the patient. I'm going to get sterile water, which I have right here. I'm going to get 30 mLs of sterile water, and I'm going to get rid of any extra air because that can cause the patient discomfort. So I got a little bit extra. Okay, 30 mLs. So I'm going to connect to the extra port. I'm going to turn it off to the block and push, and it should run in very easily, which it does. I'm going to turn it off to the patient. Now I'm going to get my first medication, and I'm going to mix as I pull back. Mix with the tip so that I get all the medication up. Again, being careful not to get too much air in my syringe because that'll cause my patient discomfort. Gonna attach. Turn it off to the block. Push my medications. Turn it off to the patient. Now I'm going to get sterile water to do a flush for medications. back off to the patient. I'm gonna get my second medication. Connect. Push my second medication. So here I have the option. I can disconnect. I can pull out the syringe or the plunger from the syringe, reconnect to my patient, and I can do it by gravity. If I was doing a water bolus. And I could do a water bolus for my patient. And then I would want to catch it just as it's ending so that I don't give my patient too much air. And then as long as I'm off to my patient, I can disconnect, throw all of it away, leave my patient in a safe, comfortable position, and monitor for any discomfort. That's my enteral meds.